A few months ago, Mama Coco spent some of her time talking to our team at our local health center. Mama Coco is a 36-year-old rural fisherwoman who lives in the heart of the Niger Delta region and who had just lost her 3-week-old baby. We talked about her pain and her regret. She talked us through watching her baby suffer convulsions and eventually die from tetanus, a disease that vaccination could have prevented. The conversation had us angry and upset. One more child lost to cracks in our vaccination program. In Nigeria, around 1 million of such children die every year from vaccine-preventable diseases. Mama Coco's greatest regret was not knowing about tetanus and the vaccination that should have prevented it.
Around 2 of every 5 caregivers surveyed in a 2016 national survey in Nigeria indicated a lack of awareness as a key reason for not being fully vaccinated. 1 out of 10 of them had no faith in vaccination. A fundamental question we therefore needed to answer was on how we can empower these caregivers to seek and fully utilize available vaccination services.
The Global Routine Immunization Strategies and Processes of the World Health Organization endorses community involvement and is one of its 9 transformative strategies towards routine immunization coverage improvement across the globe. Community investment entirely means getting community involved in ensuring that there's demand generation and the quality of service also improves. In all of these, the general belief is to entrench services that are sustainable even when partners do not provide the needed environment for this to go on.
It therefore makes sense to explore innovative strategies to involve the community in the immunization program, to create awareness, build trust, and spur social change around vaccines.
Okay. I've been working in the immunization space for the past 10 to 20 years, just in the immunization space. But I'm glad and I'm excited at the changes I'm seeing, especially when the Corona Management System came up with the Community Theatre Project. For the first time, I saw women being gathered together, being informed on the importance of immunization and the importance of the vaccines themselves. Using theatre and dancing as a medium and a strategy to truly and really explain or break down the explanation they've been getting, because anything that is done visually is not easily forgotten.
The Community Theatre for Immunization Intervention works with women like Mama Coco to co-create content that educates and amplifies the positive stories that can increase demand for vaccination. During a typical performance, community members home from fishing and the market gather at the community center and watch this local cast of other community members act out their story.
So in the target localities where we implement community theatre for immunization in Bayelsa and Rivers states in Nigeria, so what our project team has done is to work with the leadership of the health system, work with community leaders, work with health workers from the health facilities that serve those communities, and also with members of those communities to create and perform theatre. Now what you see is that rural women and community members act out the plays that we have co-created with them, and these plays are, I essentially perform to increase awareness, to rebuild trust in the health system, and to motivate both pregnant women and caregivers to actively demand for vaccination services. Ultimately, the solution is flexible, it's adapted to communities, it tells real stories, and it has an added advantage of actually bringing the vaccines to, the theatre performances with support from the community health worker and the health system in general, right? So ultimately, people can get the shots that they need for themselves and for their kids right there at the theatre performance.
The way we organize the drama by involving the women leader and other stakeholders in the community has really helped improve our services in our immunization in our facility. So therefore, I also say let this program be extended to other rural communities that are not ready to accept the importance of immunization. In my community here, I am feeling very free with my women. They are now bringing their children into the health facility, and our services are improving. Our women, whenever they hear my call, any defaulter, they will always turn out by bringing their children for immunization services.
It is worthy to note that Bayelsa State Primary Healthcare Board is an important part of the state's effort to improve the health of our people. The board is always glad to provide an enabling environment for innovations that delivers results for our people in the state. We are really glad to enjoy designs and interventions that Corona Management Team has put in place. We have worked with them to implement and monitor as well as evaluate the interventions in the state.
One of the key interventions that lately was brought in to improve immunization services was also that community theater for immunization, where we have been able to see the gains of building role models, building champions for immunization, and using our local cultures to enhance uptake of healthcare services.
A key part of the community theater intervention is to apply creative stories and anecdotes that harness the powerful role emotions play in driving decision-making towards sustained positive behavioral change. The project explores the use of storytelling and emotion in increasing demand for vaccination services and emphasizes how emotion can be harnessed to create long-lasting positive behavioral change. The theater performances targeted community dialogue meetings and religious gatherings after Sunday service as part of a design strategy to ensure that performances fit into the established routines of users.
After that day when these health workers people then come our community, when they come teach us on immunization and then come allow us to act drama with them, dance with them. After that day, change don't dey for our community. Many women they when be they like immunize their children before, then don't they go immunize. When doctor come before, so many people then go say their children no dey, their children they sleep, or person carry and come out. But now when he come, all of them don't they carry their children, they go health center. Because that day drama when they come teach us, then give us benefits on if we know immunize our children, how you go carry affect them in the future. So women don't decide say, they no go want anything go affect their children future. Mostly that part when they say very soon, then go they check children immunization card before they go Obodo. All these women in our community, no one wants their begin to go Obodo, so they don't decide say they go immunize their children. So when their children big and they won't go Obodo, it no go affect them.
We're going to be Corona Management System, and actually since 2020. When you talk about New Year, my never friend, my friend, if you want to get my friend. So to na keni to mama so everything you know work to na keni to go group to run no take le na to search the panic like about na ke e go ba to go no ni improve work right ni makeni no pray.
The Bayelsa State Government's Ministry of Health has made a remarkable improvements in so many areas in the health sector. And by the special grace of God, we still have certain areas we need to improve on our healthcare indices. And in the area of immunization is an area where we need to significantly improve our healthcare indices. And the level of community participation has not been very remarkable, but over the few months we partnered with the Corona Management System, where we initiated one of the strategies, the community theater immunization play that was introduced, and we started in the Kirimo local government. And by the special grace of God, the uptake at the community level has drastically improved from the indices we are getting here. And we hope to improve on it and expand that to other local governments. And by the special grace of God, this is a great innovation and strategy we have gotten and ensure that will improve our healthcare indices here in Bayelsa State.
Bayelsa State is indeed working to become a bedrock of health systems innovation, and this is a show of political will and an enabling environment. The Community Theatre for Immunization Intervention is one such innovation that has thrived in Bayelsa State, with Corona Management Systems and the Bayelsa State Ministry of Health partnering successfully to test this innovation and deliver some exciting results. The community theatre was built to test the hypothesis that caregivers will demand immunization services as a right if they are engaged through a human-centered process of trust building, education, and social support. Results from intervention communities clearly demonstrate an increase in knowledge among caregivers who act in the play and an increase in knowledge among attendees at performances. The results demonstrate a reported increased acceptance of vaccination by attendees and significant declines in proportion of caregivers in intervention communities who report either lack of information, lack of trust, or lack of motivation as a reason for their child's incomplete vaccination. Reports also clearly demonstrate important experiential results in deploying theatre through a human-centered process, with reported satisfaction by attendees, positive net promoter scores, and the utilization of available vaccination services provided at the theatre performances. Community Theatre for Immunization has leveraged the power of storytelling and the potential role of design thinking in solving global health problems to address the challenge of increasing demand for vaccinations in Bayelsa State. We are proud of the achievements of this project, and we invite you to join us on this journey as we strive to reach an additional 2.5 million women and children over the next 2 years.